Hi, my name is Jeffrey. I'm going to be the nurse taking care of you today. Could I get your name and date of birth? Alrighty, so today I'm going to be inserting a Foley catheter per the doctor's orders. Do you have any allergies to latex, bananas, or avocados? Nope? Alright, perfect. So we're going to get started. So I'd perform hand hygiene, and then I'd gather all my supplies. So all my supplies are right here. And then I would get the patient ready for insertion. As a female, so with the female, you would flex the knees and then spread the legs apart. And with a male, you would keep the knees straight and then just spread the legs apart. Then we provided the patient privacy. So then we gather our supplies. Open up our Foley kit, making sure not to break the sterile field. And now we don on our gloves. Non-dominant hand first, making sure to grab the inside of the cuff so you do not break the sterile field. Connect my syringe to the Foley tube to get it ready. And we open up our gauze packets, making sure that everything is ready for when we start this procedure. Putting this pad down, you want to be careful and make sure not to break the sterile field by touching the patient, asking them to lift up if possible so you can get that in place correctly. So with a female, you would make sure to spread the labia so you can go in and sterilize that area. With a male, if they were uncircumcised, you would pull down the foreskin and you would sterilize the meatus by going in clockwise swabs. But with a female, you do each outer rim using a different swab every time and going around your sterile field. And then you would take your catheter, dip it inside of your water-based lubricant, and then let the patient know that you're going to begin inserting the Foley and that there might be a little bit of discomfort. And with the female, you would insert until you see urine. With a male, you would insert about 6 to 10 inches. And then once you see urine, you will continue to insert 2 to 3 more inches after the fact. So now we see urine, so now we would insert 5 milliliters of our sterile saline. Take that off, and then that would go into the sharps container after you were done. And once the balloon is inflated, you tug back, making sure that the balloon is in place and into the bladder. And then after that, you discard everything, and then you would make sure to clean up around the area that you inserted for if there was any extra lubricant, water, stuff like that. So then you would discard all of your trash. I will take off my gloves and dispose of them. And then I will take the Foley bag, and since there is no clip on this bed for this, you would find somewhere to clip it on the bed where the bed does not move. And then you would secure the catheter to the patient's leg and then label it with your initials, what time you put the catheter in and all that, and then you provide your patient with comfort. How are you doing? Are you doing all right? All right. And then provide the patient with privacy, and then do hand hygiene again. Hi, my name is Jeffrey. I'm going to be the nurse taking care of you today. Today I will be removing your catheter per the doctor's orders. Can I get your name and date of birth? I'm just going to lift you up in your bed. Then I would don my sterile gloves. Then I would unsecure the Foley from the patient. I would unclip the bag, and then I would empty if necessary if there's any fluid inside the bag. Now proceed to remove the fluid from the patient's catheter, ensuring that I get all the fluid. Once I feel resistance, I know that I have all the fluid. Take that out. That'll go in the sharps container when I'm done with that. I'll remove the catheter. Now I'll dispose of everything inside the trash. I'll get the patient comfy in bed. How are you doing? Are you all right?